Welcome everybody, I'm your host Didi Verg from miraclesofmind.tv, and today it's my very special guest who I'm very fortunate to interview is Ron Eslinger, so welcome to the program.
Glad to meet you. Thank you very much for inviting me.
Not a problem. So let me tell you a little bit about Ron. Ron Eslinger has helped people from all walks of life with all kinds of pain succeed in many ways they never dreamed possible. He is a National Guild of Hypnotists, Certified Hypnotist and Master Instructor, and in hypnosis circles, because Ron is a former captain of the Navy, he is known as the Captain of Pain due to his 40 years of work experience and training others in the uses of hypnosis for pain management. He has spent over 20 years using hypnosis in hospital settings and for the U.S. Navy as a Certified Registered Nurse Anaesthetist. And I've had the very lucky privilege to spend some time with Ron this weekend, and I happen to know that he is an avid reader and researcher and completely up to date in everything that's going on in neuroscience, neuroplasticity with the brain, epigenetics. So fascinating. Please tell us, how did you first get involved in hypnosis?
Well, first was back in 1965 when I needed a project for a senior science project. And I had read a book called Searching for Bridie Murphy. And in that book it had a station where you could see somebody, they described being hypnotized. It was a session. And I looked at that and I thought, well, I could do that. That'd make a good project. And I had a 14-year-old sister, which was good because in the book it said I needed somebody between the age or 9 to 17 would be the perfect age, and she was 14. So I borrowed a little reel-to-reel tape and got her to go in my room with my sister and let her lay on the bed and let her stare at a candle. And I started hypnotizing her. And I went all through the process, even regressed her back to the first grade, asked her some questions. I was really excited about what was going on. But remember, that's all I did was read that script that they used in the book. So when I'm done, I thought I'd have some fun, being my sister-in-law. So as I'm bringing her out, I say, when she, and this is late at night, or about 8:55, I'm bringing her out of hypnosis, and I say, you'll be so relaxed, so totally relaxed. And between the numbers, I said, and at 9 o'clock tonight, you'll howl like a dog. So it's one, you'll be so relaxed. Now keep in mind, when you bring them out of hypnosis, you're supposed to be, you'll be aware and alert, but I was saying you'll be so relaxed, so totally relaxed. 2, you'll howl like a dog. 3, so relaxed, so completely relaxed. 4, you'll howl like a dog. And 5, you can open your eyes. And the first thing she said was, what time is it? I thought, wow, this is working. So we walk into the living room, and about the time we get there, the clock is striking, boing, 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 and all of a sudden I hear, ow, like a wolf. Well, that was funny until the next thing she did was the other suggestion. You'll be so totally relaxed, and she collapsed right in the floor. Now that was unnerving. That was not funny. It was less funny because my mother was sitting there and she was on the edge of her seat, I think ready to shoot her son, but I am alive today because my dad had already gone to bed. Okay. So therefore I didn't get his wrath. However, I still couldn't get her to get awake or out of hypnosis to get her in the bed. I had to drag her into the bed, throw her up on the bed, and then I'm in there in my bed saying, oh, dear God, please, if you'll let her wake up, I promise I'll never cheat on another test. My mother's in there on her knees saying, God, if she don't wake up, I'm going to kill him. And that ended my hypnosis career for the next 10 years.
Okay.
But I got married, and my mother and my sister are telling my wife about this story. Well, my wife all of a sudden says, oh, hypnotize me. I can't hypnotize anybody. I've never hypnotized anybody. She says, you hypnotized your sister. I said, I really wouldn't call that hypnosis. I just read it out of a book, didn't get a book. I want you to hypnotize. I said, what for? She said, to lose weight. Now, if you've ever met my wife, she could have gained some weight and looked better. But the point is, I went to the library in Knoxville, Tennessee. I took out every single book they had on hypnosis, all 3. And I started reading. Now, synchronicity is a very interesting thing. I'm a certified registered nurse anaesthetist. So every year I have to have so many continuing education credits. that next week, 2 weeks later, my journal came out, and in the back was a course on hypnosis for the hypnosis for adjunct to anesthesia, and it had 60 credits. It was in New Orleans, Louisiana. I took that course. I was so impassioned for hypnosis that I actually went back with 3 days of training and opened my first office in 1979 for hypnosis. And I ran that office in the evenings and on Saturdays while I still held down my full job in anesthesia. Now the lucky thing about it was the people that I worked with actually supported me so much in that. And then one of the most amazing things was we had a doctor that was he worked with high-risk OB. And when he was doing his residency, I was doing my anesthesia training. By the way, I was the first male nurse anesthetist to go through the University of Tennessee Nurse Anesthesia program. So he called me one day and said, "Ron, I've got some people we can't give medication to. Would you work with them?" So I started working in OB, and then others said, "Will you work with some pain?" But what was really interesting was everybody didn't look into this and really care about it, because I'd be walking down the hospital in the passageway, the hallway, and there's this one doctor, every time he'd see me, he'd put his hand up like that. Well, I think he's just making fun of me because he knows I went to that course, and I thought he was making a joke. Well, the next time I'd see him, same thing. Well, about a month later, I said, "How come I'm not in this doctor's room giving anesthesia anymore?" He said, "Well, he requested you not be in there because he thinks you're going to steal his brain." I said, "We got to have a brain before anybody can steal it."
Oh, yeah.
So that was kind of how I got started, stayed with it, did stuff for the hospital. In my practice, the doctors were really good. Other people were really good about sending me clients, and everything worked out really, really well. And so over the next few years, I was doing courses and seeing different clients. And the thing about it is, those were in the days where if you worked in medical, advertising was forbidden. You did not advertise for anything that you did. So therefore, to have an actual office practice when you can't put ads in the paper or those type of things, is pretty unique.
You had to rely on referrals then.
Everything was referral.
So share with us a little bit about, was it that you had the clients reduce the pain while in surgery so they needed less anesthetic, or what was your rule?
Oh, in surgery was pretty cool because basically we're giving them drugs or hypnotic drugs anyway.
Right.
So, and the one thing that is pretty well understood and researched is anybody that goes in for any doctor's appointment, especially if they're going to have some kind of a procedure, they automatically go into this altered state, this more focused, what we would call a hypnotic state. So therefore, what we say to them, especially physicians, because they have so much preeminence there, is whatever we say, they accept it as a suggestion. It goes on a part of the brain called the limbic system, and then our body responds to it. So as I would put patients to sleep, I would say things to them like, "You're going to wake up with a warm, comfortable feeling on your stomach," which was the opposite of being nauseated. So they didn't wake up nauseated.
Right.
I'd say, you should wake up comfortable. If you're not comfortable, just let us know. We'll take care of you. I'd say you may wake up with something in your mouth, not in your throat, not down in your lungs, because that would be the breathing tube. And so I said if you recognize that, just go ahead and spit it out. So I gave them suggestions that would complement being comfortable, being at ease, at peace, feeling safe in what they were doing. And when I'd start an IV, I would never say, "This is going to be a little bee sting." I say, "I'm going to put some cold stuff on your hand, and that may make it numb, like when you stuck your hand down into an ice chest." I say, or you may remember a time that your hand went to sleep. It may feel like it's asleep. When I put the tourniquet on, it may go to sleep. So I would just say stuff like that to get them thinking in a different way. So when I got ready to start an IV, I'd say, it's not going to feel any worse than this. And I may pull a little hair on their hand, or I may pinch it a little bit. What I'm going to do is not going to be as bad as this. And they would accept it really well.
So share with us, because we've all heard stories about things that were said while a patient was under anesthetic that weren't necessarily positive, and what kind of effect would that have on a patient?
Well, it depends on the patient, of course, but I can give you a real example of a client that I had when I was in the Navy. She had woke up from having a hysterectomy, and when she woke up screaming in pain, which is extremely unusual. And so they went through all of the pain clinic stuff for over 2 years. She got addicted to medications, which is what we're seeing a lot of today. And so they finally said, would I see her? They come to me and said, Captain, would you see this patient? And so I said, sure. Then they said, well, she's in addiction. I said, well, let's bring her in and detox her, because if she's out of it, there's nothing I can do for her, because she's got to be able to focus on what I say. So we brought her in. The first day that I did hypnosis with her, her pain went away,
Okay.
which was very amazing. And so I asked her, I said, would it be okay if we now investigate why you had that pain to start with? Mm-hmm. So in hypnosis, I said, I'd like you to go down and talk to that area, and let's ask it, does it have a purpose? Is there a need there? Is it willing to be let go? And I said, then when you come out, you can share with me what you find out. Well, in hypnosis, what she realized was, now her surgery was a hysterectomy, but her uterus had adhered to her bladder, so it had to be dissected off as they were doing the surgery. And somebody in the room, and she was very for sure it was not the surgeon, but somebody in that room said that is going to be one hurting bladder when she wakes up, and that was where her pain came from. Just from that statement under general anesthesia, because you never lose your hearing, so under general anesthesia, she heard that statement, and so for 2 years she suffered from unmeasurable pain because somebody made that comment while she had chemical drugs known as hypnotics.
Wow, isn't that fascinating? So what types of pain can hypnosis help with? Because I know this weekend you were sharing a lot of the different things you've used hypnosis, for example, phantom limb pain, back pain. Just share a little bit with our audience about what kinds of pains hypnosis can help with.
Well, I haven't found any that it can help with, because a lot of the research now shows that 85 to 90% of the underlying chronic pain, and even acute pain, but mostly chronic pain, is based on the stress response.
Okay.
So therefore, if you can work with stress, you can start alleviating that pain, changing where it's at. So I've worked with phantom limb pain. I've worked a lot with CRIPS, which is called Complex Regional Pain Syndrome. I've worked with that. I've worked with lots of back pains, lots of arthritic pains, knee pains, shoulder pains. Let's see, what else has been out there? Oh, tic Delarue, TMJ. Everybody that I've worked with these have all responded extremely positive, if not 100%. Phantom limb pain I got pretty good at because I was seeing so many of them. Mm-hmm. And I think I was telling you about the one today where a person at CRIPS used to be known as RSD, so regional sympathetic pain, I think is what they call. Anyway, now it's called CRIPS, Complex Regional Pain Syndrome. And one of the first phantom limb pains I worked with was an Army Ranger who was rappelling and crushed his ankle, and he got CRIPS. So to take the pain away, it was so excruciating, they actually cut his foot off. So they cut his foot off, he heals, but now he's got phantom limb pain. So worked with him, and only took 2 sessions, and the reason that they sent him to me was they had a new prototype prosthetic. Yeah, thanks. I'm getting old out there, guys. Sometimes these words don't come to me. But so he had this new prosthetic that they wanted to try with him that people could run with, and he was a marathoner. So they sent him to me, and unbelievably or not, he did well. That prosthetic was the blade that the guy used that had the amputations in the Olympics. So it was pretty neat to be a part of that. I didn't know I was a part of that until I realized that this guy was running the Olympics with the blades. But Phantom limb pain responds extremely well. CRIPS responds
What is CRIPS?
pretty well.
Just so the audience.
Complex regional pain syndrome.
Is that pain with no medical cause that they can find?
Well, it usually starts from something very simple. The first one I saw was, for some reason, after starting an IV, this young lady basically lost a lot of the use of her arms. She was in severe pain. It would almost be like somebody that's got gout, that even air flowing across it would make it hurt. She was one of the first ones I worked with, and she did actually she got better too. Others had to do with, one had just sprung her ankle, and from that ankle sprain, it actually moved throughout her, basically her entire body.
The pain did.
The pain did. What happens is the nerves change, and a lot of the blood vessels now, instead of being open and the arteries letting the blood flow through, they constrict down. So the muscles and the tissues are not getting the nourishment they need of oxygen and the blood flow, and so therefore they become extremely sensitive to anything. Now, back pain is the most common pain that's out there, and unfortunately people are told when they injure their back, take it easy for a couple of weeks and see what happens. The problem is that's probably the worst thing they can do, because those muscles then start contracting down, and if you start trying to protect those muscles, they contract even more. Years ago, when I first started nursing, in the hospital, if you didn't stay 5 days, then you wasn't sick. So they'd have to put boards on the foot of the beds, because they'd get a thing called foot drop. The feet would drop, the muscles would contract, became very painful. So that they put a board to hold the feet back up. And so therefore, in this back pain, the same thing happens. If the muscles aren't doing, this one will contract or this one will contract, and then the nerves coming out of the spine get constricted, and when the muscles contract, the blood flow quits going in, so no oxygen. It's almost like if you wanted to test it yourself. You could do that all day, and it's not going to hurt you. But if you tightened up all the muscles and you're squeezing the oxygen out, it starts burning after about 3 of those. So back pain's pretty interesting. I had an interesting case. I had a friend of mine from high school actually call and say, "Hey, I've got an employee that works for me, and he can't work because he's got back pain. Can you see him?" Well, his history was quite unusual, because in high school he actually broke his back, and he was told he'd never be able to walk again, but he did. And so he went on for about 10 years, no problems. All of a sudden he hurt his back again, and as long as his back, and he got this fear that he's going to become paralyzed again. So he quit trying to use it, quit moving around, and so everything constricted down. And all he needed was, in hypnosis, to realize that what happened 10 years ago was not associated with what he had done now. So those memories from then didn't put him down and keep him down, because when he heard it originally, it was always, "Can you feel this? Can you feel?" As long as he could feel what was happening, then it was okay. But when he couldn't feel it, that meant he was really in trouble. So,
well, in his mind, he was going to paralysis. So.
Exactly.
Wow. So what are the possibilities? Let's say I'm driving along and I come upon a car accident and somebody is severely injured, the pain is kicking in, they're bleeding a lot. Can hypnosis be used in a situation like that?
Oh, yeah. First of all, when they're in shock, a couple of things happen. Number one is they don't bleed as much in shock, so sometimes you don't want to take them out of that shock. But what you do want to do is, for first responders, one of the main things is saying, "Okay, I'm here and I'm going to help you." So get him in that. But you could actually, when they're in that shock, they say, "Stop bleeding," and you'd be surprised how many people will stop bleeding.
It's just that simple. You just say, "Stop bleeding."
Look at me, stop bleeding. Now allow yourself to just listen to the sound of my voice. And so now they're focused in one area. Everything else starts basically healing itself, because the stress hormones are not coming down. Anytime we're stressed, our immune system quits working. Our healing starts working, because all stress wants us to do is fight or flight. Hit the road, fight, get out of the way. So yeah, if we come across that, we can say, "Okay, stop bleeding, relax, listen to the sound of my voice. I'm here. We're going to take care of you. Everything is going to be fine." So get rid of the fear, and everything usually works out really good. And there's many articles that have written that people have done that. Even in surgery, you can say, direct your blood flow away from the surgical site. Lots of research there, right. And the blood will change where it's going.
And in terms of helping after surgery people manage pain, can you put suggestions in where there's far less pain, so they need less narcotics?
Oh, definitely. So, as a matter of fact, in 1984, I created my first CD set. Well, that wouldn't be correct. It was my first tape set. CDs hadn't been developed yet. So I developed my first set. I put it on every patient I put to sleep. They listened to this looped tape, and it basically said, you'll wake up feeling more comfortable than you thought you would be. Because you have to be careful. If you say, you're going to wake up feeling totally comfortable, and they feel anything, they may associate that with pain. So you wake up feeling more comfortable than you thought you'd be, your surgery's going well. There are about 26 little statements on there that every patient that I did over the next 30 years, that they heard that. Mm-hmm. And it definitely made a difference. And the people who could tell you it made a difference were the PACU nurses, the post-anesthesia care nurses, because they took care of them and said, mine all did well. And then I've been teaching nurse anesthetists this since 1999. I started going out and teaching these programs. Actually, that's not true. 1996. I started going to the state anesthesia associations and teaching how to talk to patients when you're bringing them out of hypnosis, when you're bringing them out of surgery, how to talk to patients during surgery to have better outcomes. Now, there's a lot of research, part of it by Dr. Oz. I was actually involved using my tapes in some research done at Dwight Patterson Air Force Base, where by listening to this, all of those patients ended up with less pain, less nausea and vomiting, and less time in the PACU and in the hospital. Another research showed that patients who had long bone fractures, such as the femur or the tibia or the humerus, if they had hypnosis before surgery, they all healed about 2 weeks earlier than the ones who didn't. And spent 2 to 3 days less time in the hospital than those who didn't have the hypnosis.
Geez, you'd think that every hospital would want to hire a hypnotist after hearing that kind of research.
Well, let's talk about that, because there is a lady, did a really great job. She created a CD for an insurance company, and that CD they would play starting about 2 weeks before the surgery if they knew. If they didn't, it's right before the surgery. And this was reported on public radio, and it was reported in ANRP. Thank you. You're going to be old someday. So anyway, what they proved is if they listened to that CD before they came to surgery, they saved about $2,000 on every single patient. Okay, and that's a lot of money, because you're talking about you're talking about this is California. So we're talking about tens of thousands of patients going to surgery, and you're saving $2,000.
Okay, so did that ever go anywhere? What happened?
Of course not. Who saved the money? The insurance company saved the money, right. Not the hospital. So every $2,000 that the insurance company saved, the hospital didn't get.
Oh, okay.
So there is no money in using hypnosis to prepare people for the hospital. Now that's unfortunate.
Yeah.
Unfortunate. Now in the military it was the opposite, because you didn't have the insurance, you had yourself. So I did a lot of training within the military, and still do, for teaching people how to talk to patients and how to become hypnotists and working. And now we're working with some of the veterans hospitals. So the whole point is who benefits and who's the customer. If the insurance company is the customer to the hospital, then hypnosis doesn't have a lot of... Let's go back to the point, what are we talking about in the news right now? Everybody's developing a pill. Hypnosis would be great for all these people that are addicted to opioids, but yet what are they doing? They're spending millions and millions of dollars to develop an pain-killing drug that, quote, is not an opioid and not supposed to be addicting, but they did that in the 1950s with Demerol. This won't be addicting. Oh, unbelievable people. And then the other one was with methadone, right? And, well, that won't be addicting. Well, that didn't work so well.
Yeah, and they said smoking wasn't bad for us either.
Well, I wouldn't know. I didn't smoke.
Exactly.
But yeah, there's a lot of things they say.
So let's talk about the most miraculous things you've ever seen as a result of using hypnosis in your career. Can you share with us maybe some stories about clients that you've used hypnosis with that achieved the seemingly impossible?
Oh yeah, I mean, I've seen clients like for fibromyalgia and crips, of course, the things that are long-lasting, phantom limb pain, that these people have been in terrible pain for like 15, 20 years before I even see them, not even knowing that something like this was out there until they've talked to somebody, or I've done a talk at a Kiwanis Club, Rotary Club, Lions Club, and they say, well, could this possibly help me? Most of them have been the phantom limb pains because they just really do well. One lady that I saw from California had multiple surgeries, had her complex regional pain syndrome for over 6 years. It had come all the way from her ankle, now all the way up to her body. She had to have multiple surgeries. She had to have a spinal cord stimulator put in, which didn't work. So she had all these things. Her life was in a disaster. She was victimized from the surgeries that didn't work. She was couldn't do things with her family, and she was in her late 30s. She was like a extremely young person, had to go through all of this with a couple of kids, a husband, all these things going on that she could not partake of. She had a couple of procedures done in Germany, one done down in Mexico after everything they'd tried out in California wasn't working. And she was just amazing because when she came to spend a week with me, when she left, she wasn't having to use a cane, she didn't have to use a walker, she was out ready to go hike and do things with the family. And it was amazing for her, so amazing that she actually came back, become a hypnotist.
Wow.
And that is now what she specializes in, is working with people on what she had her problems with. She came to the pain course that I teach, and she took that model back, and she's very popular now as a specialist in that area.
So typically, if you're working with somebody like that who's had all these like traumas from surgery and a lot of pain, how many sessions would it take to at least bring that pain down to a functional level where the person could function out in the world?
No way knowing. Everybody is so different.
Okay.
Hypnosis kind of comes in stages. Some people are highly hypnotizable. Some people are not so hypnotizable, even though a lot of people say, well, I can't be hypnotized. What they're really saying is I'm not going to let you hypnotize me, because everybody can go into some state of relaxation or trance. So it depends. A highly hypnotizable person can actually make themselves worse by giving them suggestions that they're not feeling good, the pain is getting so bad, and this. Those people actually don't take that many sessions.
Okay.
Now you take somebody who is not very hypnotizable or moderately hypnotizable, so they take a little bit more time because it takes repetition to do this. Keep in mind, most of us use hypnosis on ourselves every day. If you're driving to work and you get there and you don't even remember passing this intersection, going across this bridge, that building, or whatever, you're still thinking. Well, when you're thinking, you're basically in an alpha state, so what you're thinking is now getting registered on a part of your brain called the limbic system, so you're actually changing your behaviors. I kind of make a joke, a lot of people get divorced when they're driving to work because they're thinking about all the bad things their spouse does. Some people get fired too, by the way. But the point is, you change your thinking. It changes a chemical component in the brain, or multiple chemical components, and that changes that behavior. So it all comes down to whatever you're thinking. So if I'm thinking, oh God, I dread tomorrow because I know I'm going to have a headache. Every time I do this, I get a headache. It's kind of like the guy I was talking about today. He kept saying that his job was a pain in the rear, and he ended up with this major painful thing called coxagodynia, which is pain at the bottom of your tailbone. And in hypnosis, when we talked about, okay, what do you think happened that made this happen? Let's talk to your subconscious in hypnosis. And it was because he kept saying to himself, this job is a pain in the rear. How many times have you said, this person's a pain in the neck? you get this gut-wrenching feeling. If you keep saying to yourself, I don't feel good, I feel bad, this is a pain, then your body is going to respond because it only does what you tell it.
So basically what you're saying is we hypnotize ourselves and they come to you to be dehypnotized.
Well, you got to dehypnotize them before you can rehypnotize them and get it fixed. Exactly. And really, that's what it is.
We hypnotize ourselves by our thought patterns and what we're telling ourselves. Yeah. And at some level, you were mentioning this weekend that the mind-body level are one. They are the limbic system, and that is listening into every thought we have and making it true.
Exactly. And then the spirit which goes there, which are the emotions. Right. Because you don't have any type of an emotional response until you have the thought first.
Sure.
Remember we talked about eating the lemon. If you think about eating a lemon, you still get the feeling and the salivation because the mind remembers what happened when you ate a lemon and it responds because it thinks you're actually eating the lemon. Try that if you don't believe me.
So for every thought we have, basically, there's a biochemical correspondent happening in our body.
Exactly.
Okay.
Just think about this. How many times have you thought about somebody that made you angry? And all of a sudden you get angry again.
You start to shake.
Or something that happened in your past that was really sad. Maybe a loved one passed on or something. All of a sudden you have that gloomy feeling again.
Right.
But I can remember driving to work with my grandson when he was like a toddler and thinking about the things that he did that were so funny that they do at that age. And I knew the guy driving beside me thought I was crazy because I was laughing out loud.
Right, which is good for you. Many people have healed many diseases by laughing.
Well, let me tell you about something I did with him because he's had a lot of hypnosis, if you don't mind.
Absolutely.
Well, he came into me one day. He was 2.5, so age really doesn't matter. Mm-hmm. The oldest person, though, I worked with was 93. So age really doesn't matter. So he comes in. He had these fever blizzards. Papo, it hurts. Papo, it hurts. Well, I said, here, let's take it away. So I just sit him in my lap. Now, one of the major things about hypnosis is intent. Mm-hmm. And he trusted me. So I said, here, let's just take it away and throw it over there. We'll just throw it over there. So the intent is, he trusts me, that we're actually throwing it over there. Because at that age, they're only in theta brainwaves, so whatever you say is truth. He falls asleep. I thought, well, that's pretty cool. Mm-hmm. Well, the next day, I'm with him. It's on Saturday. We're watching cartoons together, and he's trying to drink out of a sippy cup, and Papo, it hurts. Papo, it hurts. Well, I said, here, let's take it away. And so we do this, and we do this. Well, a little while, he takes off and goes and plays. He's comfortable. He's drinking. About an hour later, he comes back, and he says, Papo, do this, because he had already learned that that was his medication. Now, 2.5. At age 3, on his birthday, we buy him a tricycle. Now, I know when he's out there driving it, or riding it in the driveway, he's going to turn it over. I learned that when I was in the 7th grade, because I used to watch Laugh-In, and they had this guy that kept turning over the tricycle, and the government did this really good research. And they found that it cost them $300,000 to realize that why tricycles turn over. Okay. All right. So he's riding, and yeah, it happens. He turns it over. So I'm getting ready to go up because I know he's going to get up crying. Mm-hmm. But what he does is he stands up and he starts doing this to his leg. Wow. To his leg. So he's become a self-healer.
Okay,
but I got to finish that. So now it's a few months later, my mother-in-law shows up. Well, you'd have thought I got the headache, but I didn't. It was my wife. So my wife goes to lay down, and Drake, he's my grandson. So he's out there, and all of a sudden he notices where she's gone, and so she's gone to lay down because she's got a headache. So then all of a sudden I lose him. Well, I go into the bedroom, she's on the bed, he's up on his knees over her, doing this to her to take her headache away. So I have a true healer.
Okay. So I'm sure you used it his whole life, have you not?
Well, up until age 16. And at 16 he comes to me and says, Dad, I can do it myself.
Okay.
But up until then, in order to manipulate, to guide the way he saw things and how he did in school, I would tell him stories, which is hypnosis, as he was falling to sleep at night.
Mm-hmm.
And he did really well. He got a really nice college scholarship for football. So
There you go. So your hard work paid off.
yeah, I got my money back.
So what do you think are the limits of hypnosis when it comes to medicine or pain? Are there any limits or?
Well, I think the biggest limit would be truly untrained hypnotists.
Okay.
And I mean hypnotists in general, doctors, nurses, anybody who does hypnosis is not having the right training for what they want to do, because it's all about words, and it's about intent, and it's about belief and faith. And if you don't have the right words, then you're not going to get the right outcome. So how do you find out what the right words are? Believe it or not, that patient, that client that you work with, they will tell you what the words are. So you have to learn to listen, do a good interview, but you also have to do the research. I had an amazing lady come to see me one time because her eyes, all of a sudden, she got a thing called blepharoplasty, and she couldn't open her eyes. They just do this all the time. They just totally blinking, and she couldn't open them. And she had already had Botox, she had had medications, and she called me on a Wednesday before she was to have surgery to have the muscles taken off her eyes so her eyes wouldn't close, which meant now she had to have artificial tears all the time, and she had to sleep with pads on her eyes so that they wouldn't open and dry out. So she came down, and I worked with her one afternoon, and she was basically my age, I guess, about that time. But the thing that happened was she was not a very highly hypnotizable person. But she wanted this to happen. She didn't want to have the surgery. So that afternoon I saw her and went through a lot of different metaphorical stuff on, your eyes will start doing normal blinking, like turning on lights and turning off lights is normal, opening and closing shades is normal. So just giving her an image or a picture of what could happen. Well, the next day I'm expecting, I didn't know if they'd show up because I wasn't that happy about how things went, or confident, I guess would be the right word. So she comes in the next day. This is the first time in 6 years I've been able to see myself put my makeup on. And she got better and better and better after that, and we still stay in contact. So it's pretty cool.
Very cool. So if there was one thing you wanted to leave our audience with about just what you think they need to know about how powerful our minds are, what would that be?
I think if we want to talk about hypnosis, I would say getting rid of that fear of hypnosis, because you control your mind. Hypnosis will never take control of you. And the mind is extremely powerful because the mind controls every cell of your body, and every cell has memories. So if we can go back and visualize using our brains, using our minds to see ourselves healthy, see ourselves healing, see ourselves comfortable, see ourselves at that optimal weight, see ourselves getting rid of addictions of all types, then our body starts changing because we become that which we think we are. However, it has to be done not once a week, once a day. It has to be something that's done and repeated extremely frequently over and over. I'll leave you with this last thing because I see a lot of people that have trouble sleeping. One of the things they say is, oh, I can't get to sleep. Then they can't get to sleep, and then they start worrying, if I go to sleep, I may oversleep, so I'm not going to get to work on time. And then, like for anesthesia people like me, and you're laying there half night saying, oh no, I'm not getting any sleep, I hope I don't hurt anybody tomorrow, those types of things. When all you really have to do is say, I'm relaxed, I am calm, I am asleep. The brain works at maintaining whatever you tell it you are. And it's a particular part of the brain you want to look up. It's called the limbic system, L-I-M-B-I-C. It controls everything that goes in our body, and it listens when we talk to it, or it listens when other people talk to us. So you have the power in your own brain, through your own thoughts, to control who and how you are.
Well, thank you so much, Ron Eslinger, the captain of pain.
Thank you so much, and I appreciate you letting me be here.
Thank you.